I'm undergoing a dilation and curettage surgery at a Red Cross hospital in Japan this coming Tuesday on June 26th to remove the many and large endometrial polyps that I have inside of my uterus. The reason for doing this video is two parts. So first, I didn't want to type out a long and toneless or faceless post to my friends and family. Hi everyone. And the second is that when I was still caught in the deciding phase of whether this operation was going to happen or not, I could find no English language sources about the operation here in Japan and what to expect from it here. When I did find vlogs from women who were getting endometrial polyps removed in North America and the UK, almost all of them were situations that I was worried didn't really apply to me, which I'll get into a little later. The English language sources that I did find used different terms that did not prepare me and caused some confusion when I was speaking with a doctor here. So if anyone one day finds this and is in the situation that I am in now and have been, I hope this helps you some. Before I get into explaining the procedure I'm going to do, let me get into an as quick as possible summary of the last 8 months or so and why this is happening now. This started in October 2017, when I noticed that my menstrual flow was suddenly much heavier and more painful and physically taxing than the month before. The first day of that period came on the 8th, while I was in Tokyo for my birthday. So for the first couple of days, I dismissed it as just a product of too much physical exertion because of the trip. On the 10th, 2 days later, I had a small birthday dinner, during which I started to feel levels of pain that left me short on breath. And I bled through a super tampon that I had put in just an hour before. I also discovered that I had passed a large piece of tissue, almost twice the size of my tampon in length, and about 2/3 of the size in thickness. During that October, I also discovered some differences in my menstruation that by themselves wouldn't have been alarming, but combined with the other stuff did make it noticeable. My period used to last roughly 5 days, with the heaviest bleeding in the first 2 days and the last 3 days having increasingly lighter bleeding. During those last 3 days, it was not necessary for me to take any pain medication. During last October's period, I had heavy, painful bleeding up until the 4th day. During the last 8 months since that October up until now, my period has only become increasingly heavy and painful every month, with the exception of March, which had a heavy flow but a more manageable pain comparatively. In November 2017, the pain and flow had increased significantly from just the month before. So much so that when my period came on the 5th, I was in so much pain that I couldn't sleep even after painkillers. The following day, November 6th, the pain was so bad that I couldn't walk and I could barely even get to the bathroom without assistance. I stayed home from work that day, and on the next went to see a doctor at the Red Cross hospital in my city. The gynecologist did a vaginal ultrasound test, after which he proceeded to be baffled by the existence of my uterus and ovaries. In the end, he told me it could be anything and was probably just a heavy flow, and prescribed me 25 milligrams of Adeflonik. That period, and the 3 that followed it, lasted 6 or so days, in which I was bleeding heavily for 4 of those, and was desperately taking painkillers up until the 5th day. During those months, I would take the prescribed Adeflonik 2 to 3 days prior to my period, unless it came early. And during menstruation, I would combine that painkiller with Japanese brand over-the-counter menstrual medicine, such as Bufferin Luna or Eve. After those long winter months of this not working and having to miss a couple of days of work each month, when my period ended on February 2nd, I looked forward to an appointment on the 15th of that month with the doctor. However, he continued to act as if he hadn't spent years specializing and studying typical female reproductive organs, and said maybe I might have polyps, which would not only explain the pain, but would affect my rates of infertility and my ability to carry a child to term. But when pressed by me about what we could do to verify this from a maybe to a much more certain thing, he informed me that there was a test that they could do, simple enough, but that he didn't deem it necessary for me to get an actual diagnosis of what was wrong with my body. My husband, with the knowledge of history of cancer for women in my family, demanded an appointment to test the confirmation of polyps, and if present, whether or not they were malignant or benign, cancerous. The doctor also prescribed me a stronger dose of 50 milligrams of Adeflonik, to be taken as a suppository for the period in between then and the next appointment. The polyp testing took place on March 8th. My uterus was filled with a liquid, and then an ultrasound was done, and the polyps were confirmed. Then a thin metal rod was inserted through my cervix into my uterus, and the tip was used to scrape at my uterine wall and take a sample of the polyps. This was done sans any pain medication. It hurt. I received a letter from the hospital confirming that the polyps were benign 3 weeks later. However, despite now missing 4 days of work a month, due to the crippling pain and me filling up a super tampon and half a maxi pad used at the same time within an hour, that doctor did not recommend the removal of the polyps because I was young. He recommended that I try to get pregnant for 6 to 8 months. And if at that point I couldn't, then I could come back and request their removal. My comfort, physical health, and quality of life was not taken into account in this recommendation. In the 3 periods that followed that final appointment, I would take a combined amount of 75 milligrams of Adeflonik, combined with 30 milligrams of Famotidine to protect my stomach. In addition to that, I also took Japanese over-the-counter Bufferin Luna, as well as American over-the-counter naproxen sodium 220 milligrams. Liquid gels. I was still bedridden with that for at least 3 to 4 days out of the month, in which I was curled up in crippling pain with a heat pad. On a trip to Tokyo with David's family on April 26th, the second day of my period that month, I passed a tissue that I described as half the size of my uterus. I decided to photograph that tissue for proof of its size. My only thought was to save that picture to show to a doctor in America who might somehow be able to help me. I didn't feel I could do anything else during my time here. On Friday, June 1st, I called an ambulance after having a large amount of pain that seemed to be coming from my cervix or lower uterus. It was so bad that I couldn't sit up straight. I was not menstruating at that time, and my period had ended a week before. The pain that led me to go to the hospital that Friday morning had started Wednesday night. It was a very faint, dull pain starting Wednesday late at night, but by the time I returned home from work on Thursday, the pain was no longer ignorable, and it left me unable to sleep for most of the night. Once on the hospital, after doing tests to verify that I wasn't pregnant, and then doing a CT scan to make sure that it wasn't my colon or any of my digestive organs, I was sent to a different female gynecologist at the hospital. Generally speaking, I prefer to have a gynecologist who has a lived experience with a uterus and ovaries. If you go to a stomach doctor and explain to them something wrong with your stomach, they know what feels normal and what doesn't. Once there, she immediately noticed my polyps and asked if I was scheduled for surgery. As a note, if you're seeing a new doctor who immediately upon seeing your condition recommends you a form of treatment, do not mention something that a doctor who you know didn't listen to you said. At the very least, until you hear why that new doctor is recommending this treatment option to you. Your doctor is more inclined to listen to what another doctor is saying rather than believe you about what you're saying about your body. And if you tell them that the other doctor didn't listen to you, you are labeled as a problem patient. She scheduled me to come back for an MRI on the 13th because I had a polyp so large that they needed to make sure that it wasn't a tumor on my uterus. I came back on the 18th to see the results that showed that it was a polyp and not a tumor. During that session, we discussed surgery. I have been on bed rest since June 1st until June 7th with the cervical/lower uterine pain. I had a mandatory conference that I had to attend on the 8th. However, even after the week of bed rest, the pain never really left if I did anything even slightly strenuous. With this in mind, I pushed for surgery. She was only reluctant at first because I had foolishly mentioned what the other doctor had said previously, but after hearing me out, she acknowledged my reasons for having surgery and she signed me up for it. So let's move on to that procedure. If you look up removal of endometrial polyps online, you'll see that the common standard procedure is hysteroscopy, which gained popularity in the 1970s. This operation uses a hysteroscope, which is a thin metal tool with a small light and camera at the end of it, to help directly guide the operating doctor. There are a few ways to remove a polyp, but the most popular way I've seen women in North America and Europe undergo is via a tiny precision claw that clamps onto individual polyps picked up in the hysteroscope and removes them. When searching for first-hand experience with an hysteroscopy and endometrial polyp removal, I found almost all accounts to be blogs from women who were struggling with infertility and going through IVF treatments. The operation my doctor is doing is D&C, a dilation and curettage. In Japanese, it's called Cug宮内膜全面掻爬術, which they'll translate to English as an endometrium curettement, or Google Translate would say an endometrial curettage surgery. The surgery being done on me will be guided by an ultrasound, not an hysteroscope. When searching for accounts of this operation, nearly all vlogs refer women who had undergone this to remove a miscarriage or parts of a miscarriage that their body had failed to expel naturally. Since almost all vlogs were on channels by women who were struggling with infertility, and their situation did not feel very applicable to me, watching these videos didn't help much in deciding whether I was going to do the surgery or not, nor did they ease much of my worry about doing it here. Although they were a bit helpful in other ways. So if this video has the chance to help someone else, then I am determined to take the time to make it. So let me detail the procedure. I come in at 8:30 a.m. when they will insert a laminaria into my cervix. This looks very much like a thin tampon and functions much like one as well. The laminaria will expand for my internal moisture and will soften my cervix for dilation. I'm allowed to take my usual painkillers for this. At 4 p.m., I have to go in for operation. From what I understand, I will be sedated and have local anesthesia. I was told they'd give me something to make me sleepy and out of it, but not make me completely unconscious. They also said I'd be given an anesthesia into my veins. She motioned to my arm, and I believe it's administered via IV. Not 100% sure. The translator told me at some point that I shouldn't feel any pain between my waist and thighs. The operation is expected to take 30 minutes, during which time my cervix and vagina will be clamped open, and the doctor will use a curette to scrape away my uterine lining and the many enlarged polyps that I have in it. After this, I will stay overnight and into a second day, and then I will be sent home. I should have 3 full days of bed rest, followed by 2 weeks of no strenuous activity. This means no biking to work, lifting anything slightly heavy, or doing any type of exercise. Additionally, I should use a pad, not a tampon, to catch any bleeding during this time. I was also very shyly told that I should, she was like, you should not have intercourse at that time. From vlogs I've seen, that seems to be an aspect that many women lament about, but I'm asexual, so I don't care, and it's 2 weeks anyway. So I just need to monitor myself and take it easy during those 2 weeks, and then I come in for a follow-up appointment to make sure that everything's okay, and if it is, then I'm done. So something that I'm worried about is that the anesthetic won't be effective, and or that they won't give me any pain medication post-operation. Japanese healthcare is infamous for not giving adequate medication for pain, so nervous about that. I wish I could afford to wait a couple of months and do this in America, but even if I got health insurance, I've heard that this is considered an elective surgery, which can cost at least $3,000 to $5,000. In Japan, the whole thing's about $400. Aside from the worry of pain, I also wish it was done with staff who could speak my language. Even with a translator who is amazing, there are still things that are missed and hard to convey, and there also is when she's gone. I can't ask the thorough questions that I would ask at home over here. It's hard to be far from home for this, but I have David, so just pray for me. And obviously I will update you on how it goes afterwards. Bye!